Hi, I'm Dr. Surindher. I'm the Director of Cosmesis India and I'm a practicing aesthetic and plastic surgeon in Bangalore, India. Another common problem which most of us get queries from and most of us face is dark circles under the eyes. Dark circles under the eyes is a very common problem because of the eye strain and because we have a lot of people using computers and there is a lot of constant use of your bombardment of rays towards the eyes, and then of course once you get exposed to sun rays, and then there is the ultraviolet rays, so there is sun damage that is also adding on to it. And of course the aging factor also comes in, for as people grow above 35 to 40 years, then you have there is loss of facial fat, which also causes an aggravation or accentuation of the dark circles. The dark circles, there are two aspects to it. One is of course the pigmentation itself, and then the second aspect, as I said, is once you lose the fat, there is a hollowness there which accentuates the shadows, and then that is what shows up as even worse, the dark circles worsen. Now there are many treatments for it, all have limited efficacy, and sometimes you might have to do a combination of treatments to get the best results possible. The problem with dark circles again is your abuse or the exposure to sunlight, the strain, the computer usage, the aging. It's all a constant process, you're not stopping it. So yes, whatever treatments that you do, you need to maybe repeat them after a few months or years depending on what your problem is. Most commonly what the dark circles treatments are, as if it's only the pigmentation part, then of course you need to have a look and get your eyes tested, see if you're undergoing any eye strain because of which your eyes get tired. There is increased blood circulation there is increased blood stasis there, and that is what causes the deposition of the pigment to give you a dark circle. Then you have some localized creams that you can give. We give you some vitamin C creams or roll-ons which add to, of course, oxidizing or taking away the pigment, and of course improving the collagen under the eyes, so that thickens your skin to give you a little more lighter pigmentation. We give you some local pigment lightening creams which have to be used in combination with a sunscreen to prevent any further darkening of the skin. Then we have some chemical peels that we can use. These peels are very mild peels because around the eyes the skin is very thin, so you cannot use very commonly used harsh peels. These are very mild peels which have to be done in multiple sittings, so that also helps lighten your pigment. But it's, as I said, you need to keep a maintenance later on with the use of creams and the use of vitamin C gels, which will help prevent it coming back again very fast. But if along with the pigmentation there is a hollowness which has to be corrected, then that is usually done in two ways. Either we can do a filler, which is basically we inject the fillers to fill up the volume loss there, which again helps in bringing out your hollowness, and that is where the pigmentation is not seen so much. Second thing you can do is what we do is called autologous fat grafting or nano fat grafting. This is basically the fine fat that we take from different areas in your body. We filter them, and that is a fat which is injected just around under the dark circles in the eye. The advantages are twofold. When you're doing fat, it is your own tissue. Second thing is because it is live tissue, so it brings in more blood supply, but healthy blood supply. It improves collagen deposition there. It improves your skin quality there. And in the long term, it tends to improve the pigmentation aspect also. So that is a surgical option that we can give when you're looking at permanent or resistant dark circles when you have a hollowness as well.